Diabetes is becoming more common in the United States, with approximately 1 million new cases diagnosed each year. Today, nearly 17 million Americans aged 20 or older have diabetes, including individuals of nearly every race and ethnicity. Diabetes occurs when the pancreas does not produce any insulin or produces very little insulin, or when the body does not respond appropriately to insulin. Insulin is a hormone that is needed to convert sugar, starches, and other food into energy. The process of turning food into energy is crucial because the body depends on this energy for every action, from pumping blood and thinking to running and jumping. Although diabetes cannot be cured, it can be managed. Some people control their diabetes by eating a balanced diet, maintaining a healthy body weight, and exercising regularly. Many individuals, however, must take oral medication and/or insulin to manage their diabetes. Type 2 diabetes is the most common form of diabetes. When you have type 2 diabetes, the body does not respond correctly to insulin. This is called insulin resistance. Insulin resistance means that fat, liver, and muscle cells do not respond normally to insulin. As a result, blood sugar does not get into cells to be stored for energy. Type 2 diabetes occurs gradually. Most people with the disease are overweight at the time of diagnosis. However, type 2 diabetes can also develop in those who are thin, especially the elderly. Kay Pomeroy is a certified diabetes educator.
A certified diabetes educator is a health professional who has had extensive education and experience working with diabetics, helping them to learn the skills and knowledge they need to manage their diabetes. It can be a dietitian, a nurse, a pharmacist, a physician, a podiatrist, any health professional that has taken additional training and education. The certification requires passing a national exam and also ongoing continuing education to maintain the certification, which does help to assure the client that they're receiving the most up-to-date information from you.
Kay travels throughout the Midwest teaching people about type 2 diabetes. At the Henry Ford Village, a senior retirement home in Dearborn, Michigan, she is talking about stress and how managing stress is an important tool in managing type 2 diabetes.
Definitely finding something that works for you, and everybody's different in what they enjoy. So finding an activity that works for you that helps you to get your mind off of the problems that are stressing you. That's very important. Should you ever try to fix the problem? Sure, it depends on what the problem is, right? Okay. Obviously, if it seems to be a physical problem, you need to call your doctor, get an appointment, maybe you need to go to urgent care. If all of a sudden you've got a temperature of 105, you need to do something, right away. But if it's not a physical problem and it's an emotional, psychological, you're irritated with someone or something's gone wrong, 10 steps towards reducing emotional stress. And the very first one is to find out what is the cause of your stress. If you think it's multiple problems, you may want to get out a notepad and try to sort it out on paper maybe, because sometimes it's more than one cause. But if you can identify what's the biggest issue there, and then list out the parts as number 2 of the stress that's beyond your control. Don't you think that's probably the biggest thing right there? Is figuring out what you can control and what you can't. But that can be really difficult when you realize what's beyond your control. Is it always easy to just let go of it and say, no, it's not easy at all?
And while stress is a major factor when dealing with type 2 diabetes, it's not the only factor.
Diet is considered the cornerstone of blood sugar management, particularly the carbohydrate in foods. The total amount and how it's distributed throughout the day has the most impact on blood sugar. Second to that, I really have to squeeze in something about exercise because that's really as important as diet. And certainly the person's physical activity level has a big influence on what their diet and meal planning should be for them for best blood sugar control.
So if diet becomes the number one factor in controlling diabetes, what specific diet should you use?
Well, that's a really good question because there's usually a lot of misinformation about diet for diabetics out there among all the good information that's out there. There is no diabetic diet. There are diet guidelines that help a diabetic to manage their blood sugars better. Carbohydrate will have the most impact on a person's blood sugar. So basically having a moderate amount of carbohydrate distributed throughout the day and choosing healthy carbohydrates is where we start with meal planning. It's not a specific prescribed diet that everyone must follow. Generally, diabetics do not need to follow a low carbohydrate diet. That's one of the biggest misconceptions. A heart healthy diet, moderate amount of carbohydrate, or even higher amounts, if they have higher activity levels, can be just fine, but the biggest emphasis is healthy carbohydrates, the whole grains, legumes, fruit, vegetables, getting plenty of fiber in the diet, the dairy products, low-fat and fat-free dairy products, or soy as an alternative is really the basis of the meal planning.
With diabetes being such a well-documented disorder, is there really a need for getting training outside of your home?
Well, a diabetic certainly can do well on their own to manage their blood sugars with the help of their physician and the many resources that are out there. I feel it's helpful for them to go through a diabetes self-management education program because you can learn a lot more information about other topics that you may not get from the internet or from books that you buy. Topics such as how to best manage when you're traveling and you're off schedule, how to manage when you're under stress, if you're sick. There are a lot of considerations there to keep yourself safe and to prevent extremely high or low blood sugars. Certainly for many diabetics, they will learn from the other individuals in the classes that they attend when they go through one of those programs and get support and understanding that other people are dealing with the same type of issues they are. So it's beneficial from that standpoint. Certainly for fine-tuning the diet and being aware of the changes that can take place over time. Diabetes is considered a progressive condition or disorder, meaning that the body may over time produce less and less insulin, become more and more resistant to the insulin the person makes, and there may need to be changes in the treatment plan. And if a person goes through an entire series of classes, they're much better prepared and aware and looking out for these changes so that they can get help from their physician and change their treatment plan to stay in good control as needed. If a person is having trouble finding their local programs, they can go on the American Dietetic Association website and the American Diabetes Association website, which have a search for find a dietitian or find a diabetes educator in your area. Certainly that's one of the things that I'm involved in at Wright and Philippus is providing resources to individuals and giving information as to where they can find additional help with diabetes self-management.